Welcome back to Living 808. High cost of pet care may be a deterrent for wannabe pet owners, but there are affordable ways of taking care of your furry friends. Dr. Edlin from Gentle Vets Hawaii Kai has always fantastic ideas for our viewers, and we bring them in today for today's Animal Kingdom segment. Appreciate you being here. Thank you.
Thank you,
and of
John.
course for Doc, too.
Oh, the good boy. He's the good boy.
Running around. He's actually grabbed the golf ball, but that's okay. We got it back. Thank you. Because we might have a putting challenge here at the end of the show.
I didn't want to have to go after that in his stomach, that's for sure.
Yeah, no, I know. But if there's anybody that can do it, it would be you. Tell me, though, some of the fantastic things, obviously, you guys always do over there. But the cost of pet care, for a lot of us, seems high.
It does seem high, and the reason why is because most people are not carrying insurance. If your medical care, if you go in, you have a copay of $12 or whatever it is. But KHON is paying $600 a month for your medical care, your medical insurance. When we have a pet, if you're not getting medical insurance, it all has to come out of your pocket. That office visit you're paying $12 for may have been $250, but you don't see it. Okay, but when you go in with your dog, if you don't have insurance, you're going to see that whole $250. So it's veterinary care is really a bargain. It's maybe a tenth of the cost of the same care in a human. So it's a real bargain. But you see it. And there are ways around it, which is insurance.
Okay, well, I was just about to ask you what can be done to help pet owners, because we all love our furry friends. We all love having them, but the cost of care, like I said, could be a deterrent. What can we do?
Get insurance, just like for yourself. Now, like I say, KHON is buying insurance for you. Our clinic buys it for me, and buy insurance for your pet. And pet insurance can be a real bargain. Plans start as low as $35 a month, incredibly cheap. And they can cover a very high limit of medical care. They can cover $10,000, $15,000, $20,000. I've had cases. Wow.
As a pet owner, I didn't realize that was even available, but I guess I never really thought about it, but that makes sense to have insurance for our pets who live, my beagle's 15 now.
Yeah. Exactly, and then when they get old, they have problems, and they're expensive. Doc had a tumor we removed here.
I was going to say, I don't remember that the last time I saw that.
He had a tumor. We took it off. That's a many $1,000 surgery, okay? We actually insure Doc, even though we're veterinarians. We buy insurance for Doc. Because, yes, cost of care can be very high. And if you're not prepared for it, it can be very sad. Because you need that insurance.
But you don't want to wait until your pet gets sick, though, I'm sure, right?
I don't know if you remember when we were starting with our national health care plan, and it's like, does it cover pre-existing conditions? In that particular case, it does. In dogs, no. If you've got a pre-existing condition, it's not going to cover it. And so you have to do it, and I recommend people, when they first come in with their puppy, get insurance right now, because if he's got a genetic disease, hip dysplasia or something going on, that's a very expensive disease to treat. Buy it now, then you're covered, because it will not cover, we find the tumor and we bring him in and say, okay, I want to buy insurance now. No, that's not going to happen. Okay,
I'm going to play devil's advocate and just speak from a viewer's point of view, and I'm going to ask you a question. You're the vet. Why not just discount what you're doing for our pets?
Good question, John. The reason veterinarians get into this business is because we love animals. Yeah. We absolutely love animals. And the thing about running a veterinary practice, it's a business. It has to be profitable, or it can't stay in business. I can't take care of everybody's pets with my money. I'm not rich. Okay, I can't take care of your pet and your pet and your pet and your pet. It's your responsibility to take care of financially your pet. And so veterinary services are already discounted. Veterinary practices are not highly profitable businesses. They're marginal businesses, because veterinarians love pets, and we have a tendency to give away our services anyway.
Sure, and you know what, Gentle Vets, I'll just throw this out there for all the viewers. Gentle Vets, you have a lot of machines that do a great job of detecting certain things in pets. You've helped my dog a couple of times, and those things cost money.
They are not cheap. They are not cheap. There's hundreds and hundreds of thousands of dollars of equipment that we use.
What else can be done to control costs?
One other thing is your basic health care.
Okay.
And that, we strongly recommend getting animals on wellness plans. And what that does is allows you to budget your annual health care over the year rather than coming in at the once a year or twice a year, however often you're coming in, and all of a sudden you get hit with this big bill. You put them on a wellness plan, and basically all of that kind of care is covered. And so it's budgeted out each month, and it's $50, $70, $100, whatever, budgeted out over the course of a year, depending on which wellness plan you have. So wellness plans are a real good way of dealing with preventative care.
You know what? As long as I've known you, Doc, I mean, how old is Doc now?
Doc is 8 years old.
I see a little bit of gray coming out in his face, a little bit. It's you know, it's
I didn't
cute.
dare bring him and Rosie today, but as soon as we got Rosie, he got gray in his face. Oh. She just picks at him incessantly.
That's funny. The man will blame it on the woman. That's just kind of how it is. Doc, thank you for being here. I appreciate it.
Thank you, John.
Thank you for the information. Of course, you can always call Gentle Vets Hawaii Kai if you want to learn a little bit more, or check out their website. Doc, thank you. Much more on Living at 8 when we return. Hey, Doc.